besides gilteritinib and FLT3 inhibitors, any other maintenance strategies for AML in remission? You've finished induction, consolidation. Anything been shown to improve outcomes there?
No, not really. I mean, I think there's been some hints of and some suggestions. Certainly after transplant, the azacitidine data has been, off and on positive.
I think sometimes my impression of that data is a lot of times patients can't tolerate the azacitidine. Exactly. So though you do get some patients that may appear to benefit there's a huge number of patients that can't tolerate it and have to go off it.
That may be the difference in who
Right.
does well or not, who can tolerate it.
And there'll be a phase 3 oral azacitidine in patients who achieved a remission after chemotherapy compared to, I believe, placebo, that I think is pretty mature, and so that could help us.
That's a registration study. And
yeah.
I mean, I'm very hopeful about all these immunotherapies. There is actually some old study with this histamine analog with interleukin-2. There was a positive study. It was approved actually in Europe. Nobody uses it because it's toxic with the IL-2 and all of that. But it did improve the outcome of patients who had. They didn't do it by minimal residual disease, which is the plain maintenance study. But I do think that perhaps some immune approach of that nature, kind of like blinatumomab, would be valuable. Of course, we don't have the data. Those studies will take some time.
There was a recent publication of a European study looking at the role of azacitidine as a maintenance after first remission after intensive chemo. And the addition of azacitidine compared to not giving maintenance showed an improvement in relapse-free survival, but not overall survival. And what my criticism of the study is, those were patients who just got induction. So here they are, they're well enough to get chemotherapy, they get induction, they've achieved a remission, and most patients have returned to a good functional status, and then a decision was made not to give them anything. It's not that they got consolidation. And so it still brings me back to the question, couple cycles consolidation, which many older patients can still tolerate, or prolonged maintenance with all of the issues with prolonged maintenance.
Well, the CLGB did that trial where they did patients that did 7 and 3 and then got the high-dose cytarabine consolidation and then gave them a hypomethylene after that, and they really saw no benefit, of addition of azacitidine to standard consolidation chemotherapy in terms of relapse
Well,
risk.
I think Jorge said it well with the European study with IL-2 and the histamine analog, that with a maintenance study, we have to be very, very careful of impairing the quality of life in patients who may actually have a very limited quantity of life after achieving that remission.